Thanks for having me again. Yeah. So today my topic is about cost-effective analysis of a school-based risk avoidance prevention program. A lot of prevention we talk about is about how much we have to spend on a prevention program in order to be effective, because that is generally a debate in the stakeholders. So the paper that I would like, case study that I like to talk about today is actually we published in the Journal of Children at Poverty in 2011. I'd like to acknowledge my course, Dr. Yamada, who is not here today, and Dr. Walker. I think she's in another concurrent sessions. Thanks for them for giving me feedback. And Dr. Yamada actually is a health economist who is specialized in cost-effective analysis. So if there's any Q&A session that we couldn't answer, I would refer my question to him. Okay, so I think a lot of today's presenter in the morning and Dr. Foley or previous presenter has already talked about a lot of issues related to teen pregnancy. As we know, it's a public health priority, and then it's caused a lot of economic, social, and health cost burden in the U.S. And then actually about 4% of all teenage girls give birth each year, and teen births represent about 10% of 4 million births each year. And actually about 1 of 10 births, new mother is actually a teen. So teen birth rate in the United States is about 9 times higher than most other developed countries. And we also found that Hispanic and Black teen girls are about 2 to 3 times more likely to give birth than white teen girls. So this usually related like contraceptive methods, multiple sexual partners, or early sex initiation. And then a study that I want to introduce today is about a study we conducted in Yonkers. And as we all talk about a lot of statistics going on, teen birth rates actually in Yonkers is about 4.3%, which is about national rate is about 4%. And Yonkers alone actually even is higher than New York City, which is 5 boroughs combined, that is 3.06%. So there are about 24.8% of teens residing in Yonkers are living actually below the poverty level. And also only 65% of younger public school students actually will be able to graduate compared to national graduation rates. So the consequences of teen pregnancy and the risk sexual behavior actually is lead to the poor health school achievement, because a lot of this monitor's presenter talk about the high school student dropouts, and then also because the girls who were born to the teen moms, actually they found out that 33% are more likely to become the teen parents themselves. And also about 50% of teen moms, and actually they get high school diploma by age 22, compared to the 90% of teen girls who do not give birth. And also another consequences is that it leads to poor health outcomes. For example, the premature birth, low birth rate, babies, and prenatal complication and STD problems. So in terms of prevention efforts in the United States, in the community level in general, they are talking about teaching teens how and why to delay, starting sex and the step that they need to take if they become sexually active. And so there is a sex education in teens, and I'm sure a lot of the participants here, they work on community level. They focus on parents-teen communication and about the preventing pregnancy from healthcare providers, parents, guardians, or caregivers. And then also some, I know the community nonprofit organization or some agency, they actually provide access to sexual or reproductive health services. Another effort is that prevention effort actually focus on sex education at school. So there are 2 types of sex education in school. One focus on comprehensive sexual education, another one focus on risk avoidance, so-called absence until marriage education. So, but there is controversy between these two types of sex education. Most likely is related to birth control may or may not lead to unplanned pregnancy, and also there is an issue about sexual activity and versus sex education. And then in 2000, I'm sorry, I will skip that because time constraint. So in 2008, I think there are funding about 28 recipients that focus on absence education program. And then from there, in 1998. So from there, the federal government conduct a study that focused on absence education, try to understand the impacts. So they reach out to 11, the recipients, and then among 11 recipients, actually they go through the evaluation, try to understand who is eligible to participate in the study. So there are 4 actually absence-only education programs were evaluated. And then, as I listed here, number 1, 2, 3, 4, those are the 4 programs. So their findings actually, if you are interested, I will be willing to share you with the paper. But basically, their findings suggest that selected absence education program did not increase the risk of teen pregnancy and STDs. And then also there are some impacts on knowledge of STD and the perceived effectiveness of a condom and the control pills, because they consider this is mediator behavioral effects. So another systematic literature review, and they using the meta-analysis, they found out that actually there is no consistent evidence that showing that the type of a pregnancy prevention program change sexual activity or pregnancy risk of youth. So there is really limited evidence regarding the effectiveness of absence education program in the short term and long term. So, and on the other hand, it also suggests that incorporate components, for example, the sexual behavior, alcohol, drug use, or life planning, and that should be incorporated in terms of in the evaluation should be needed. So the review, actually, the literature actually help us to highlight that the importance of evaluating a school-based health education program that not only focus on abstinence education, but also incorporates multi-components of youth development in teens pregnancy. And then they also shows that the mediator behavior effects of a knowledge, attitude, and belief and self-efficacy on a risky sexual behavior, avoidance, pre-adolescent pregnancy prevention, and sexual abstinence. So therefore, the objective of this, the case study that I like to present is actually to understand that the effectiveness of school-based health intervention, and that focus on abstinence education program and using multi-components approach to prevent the teen pregnancy and risky sexual behavior in an urban area in New York. And then also we try to understand how much money really have to spend and what's the cost and what's the benefit in terms of the using this kind of approach and in terms of their short-term and long-term effects. So the short-term effects that we try to understand is by implementing this health education intervention, are we able to increase the knowledge attitudes about the associated health risks and their consequences of early sexual activity and other risky sexual behavior, but while at the same time they can increasing their self-esteem and the positive life experience at like the pre-test and 2 months post-test. For the long-term outcomes, we try to understand that if they are able to increase the risky avoidance of a sexual behavior at 12 months follow-up. So the study actually is a quasi-experimental design. I'm not going through the detail, but basically there is a treatment control group, and then the participants were recruited from fifth and sixth graders, which is about 900 students from 6 schools. And then we implemented 2 intervention. There are 2 intervention schools and 4 comparison schools. So we're using HERS, Healthy Respect Character Education Program, and then we implement the program in 2008 to 2009. So basically, this diagram show you that in the initial point that in 2008 when we start the program, there are 900 kids were from 6 schools were recruited, and then like I said, we have 2 schools in the comparison for in the intervention, and then we divide them based on control group, intervention group, and then we send out the consent to get their parents approved to participate in the program. And in April 2008, that the program starts. So we give them the pre-test, and followed by the end of the program, we give them the post-test in June 2008, and then we follow them up in a year later, which is 12 months follow-up in April 2009. So we basically get data from pre-test, 2 months post-test, and follow-up. So we end up like in the control group, there is, so when starting, the children actually are the 5th and 6th graders. By the end of the program, they are 6th and 7th graders. So the educational curriculum basically is 26 hours in-class lesson, and then is 1 hour per week for 6 weeks, and then we have 2 bilingual teachers, 1 male, 1 female. They do a cooperative teaching style, and then some kind of controversy question, we sometimes will separate male and the female students. And basically, those are the topics we cover: communication, human development, character development, sexuality, goal setting, relationship, health, sexual behavior, and consequences, and we talk about the media. So like I mentioned before, we did a pre-test, 2 months post-test, and 12 months follow-up, and then data was collected by the Chen, the research assistants, and then all data was completed in the written format, and with a language that is like English or Spanish, and then the survey was then the trend, because in order to avoid some kind of social disability issues, so we trained the research assistant. They were well trained to get the response. So basically, to conduct the evaluation, I adopt the model from proceed model. My next slide will show you. I'm not going through the detail about these 9 phases, but basically, we focus on phase 3, which is educational and ecological assessment. I divided all the questionnaire into 3 categories, which is predisposing factor, reinforcing factor, and the enabling factors. And so in the phase 3, like I said before, like to evaluate whether the program impact on their attitudes toward abstinence among these pre-adults and before and after intervention, that's one of the impact that I want to evaluate in terms of their short-term impacts. For the long-term outcomes, I want to see if this program are able to the long-term impact in terms of pregnancy avoidance through contraception use when plan to have sex in the next 12 months, because the previous study shows that there is mediator effects. And then here is how I categorize my variable into 3 categories. So predisposing factor basically focus on individuals' knowledge, attitude, behavior, and belief, and anything related to before an intervention. And enabling factor actually related to the environment and the community where that may be facilitated or present the obstacle to their behavior change. And then the reinforcing factor is more like related to their negative effects. For example, there may whether they get social support, whether they have a peer pressure that influence their behavior change. For the time constraint, so I see the sign now. So this is my dependent variable. Basically, I have create 5, the composite scale that summarize these 5 items, which is score 5 to 20. For the independent variable that I evaluate for long-term impact, I create an interaction term that to ask them if they intention to have sex in the next 12 months, and also intention to use birth control or prevention method when they have sex. And then because the interaction term, which is multiplied, so that means that you will have a dependent variable which score ranging from 1 to 25. And that's my list of independent variable for evaluate short-term impact, and this is my variable for evaluate long-term impacts. So